don't remember which page. Okay. First point we're going to talk about it's point for the foot. Okay? The point of the foot is located just in the anterior side. You can see that? In the anterior sideburn, but on the zygomatic bone. Okay, not above like the large intestine. It's really just beneath the large intestine on the bone. Okay? Of course, searching for sensitivity. Okay? Now, this is really for the part of the foot, and we can walk here also with angles. It's like a foot to stand like that. The plantar area is this side, and the dorsal, it's that side. Είναι σαν, εδώ έχουμε μια απεικόνιση του ποντιού κατά αυτόν τον τρόπο. Δηλαδή η ραχαία όψη είναι προς το πίσω μέρος του κεφαλιού, η πρόσθετη όψη προς το μπρος μέρος του κεφαλιού. Okay, so in that point, if you want to treat the plantar region, for plantar fasciitis, heel spur, and any issue like that, you will needle again from anterior to posterior, the needle direction. And again for foot anterior to posterior. No, so from anterior to posterior. It's like the leg stand here. So you do that from the face backward. From front to back. And the other way around. If you want dorsal to needle the dorsal side, you will do from posterior to anterior. If you have again sprain in the ankle, foot drop, any issues of that, you will do that needling. And also, if there is issues that cover the whole foot, even neuropathy or any kind of northern neuroma, you will just needle two needles in the same spot facing each other. Okay? One from anterior, one from posterior, meeting in the middle. Όπου η μία κοιτάζει την άλλη. Απέναντι δηλαδή. Okay? Yes, like that. Okay? Next point, in the same area, it's a point that treats the gastrocnemius muscle. It's basically for spasm in the gastrocnemius. If you have people that have a lot of high tonus in there, or any kind of spasm of these muscles, that's a point that you want to combine. Or surgery. Yes, also. To get it lighter and more flexible, you want to work with that. It will work about lowering the tonus of the muscles. Okay? Also with heel spur, because we have a lot of, usually with the heel spur or plantar fasciitis, we have a lot of tension in the gastrocnemius because he's pulling the Achilles tendon and then all the calcaneus and all the bone of the heel. We will combine in the treatment also this point usually.
παραδείγματος χάρη τραβάει πολύ εκπροσωπής όπως σε περίπτωση του ευματίας από το προσφυγίδας, θα χρησιμοποιήσουμε επιπλέον το σημείο του.
So the point is located exactly in the back side of the temporal mandibular joint, in the TMJ. Okay, we want to insert the needle to posterior side of it, just between the temporal and the mandibular. The temporal bone and the mandibular.
במפות האלה זה מדויק, או מוטעה רק תגידה.
Γνάφου και του κροταφικού του και η κρίνια μπαίνει πίσω από το μαστί.
Okay, so you want to maybe to ask even the patient to open.
So you said you put the needle like this?
Not from behind the ear.
Not from behind?
No. Yeah, I will show exactly.
Μπροστά τι βάζει, όχι από πίσω.
Yeah, you can ask the patient to open and close the jaw, and then you will understand exactly. It looks like a bit. It feel like a bit like that. Then you will insert in the gap the needle. You are in the opening. You found where is it, but when you needle it, then you need to close a bit. Okay, you don't need to open you don't need to open the mouth to insert the needle.
Το μαστιλίνι να υποφύγει στα κόμματα για να εντοπίσετε το άνοιγμα. Όταν βελονίσετε όμως θα έχει κλειστό το σαγόνι και βελονίσετε στο διάστημα στη σχισμή που βρίσκεται.
Okay, so the needling will be like that, towards the bone.
Και η μύτη της βελόνας κοιτάει προς το οστό, την πρόσθετη πλευρά του οστού.
Okay? Next point, it's called extra shoulder. Extra shoulder is located from the angle of, you are going 45 degrees oblique line from the angle of the mandibular bone.
Για να βρείτε αυτό το σημείο,
and just fall to the gap just before the masseter muscle connect. Okay, we want to be the gap before the muscles on the bone, very close.
Από τη γωνία της γνάθου προχωράτε με μια λοξή γραμμή σε γωνία 45 μοιρών στο
Posterior to the masseter.
Και βρίσκεστε πίσω από το μασιτήρα. Εκεί βάζετε τη βελόνη.
Basically, from the angle, you just fall inside to the bone.
Από τη γωνία της γνάθου είστε ακριβώς μέσα και είστε πάνω στο οστό και πριν το μασιτήρα.
Okay, that is good for shoulder, but basically it's good for two movements in the shoulder, or horizontal adduction, this movement, when you have pain here. It's good.
Είναι ιδιαίτερα καλό για δύο κινήσεις.
Horizontal adduction.
Την οριζόντια απαγωγή.
Or what we call the brow movement or internal rotation, this movement. Also because it's open in this area. So that will be the two movements that you will work with this point. Okay, horizontal adduction and internal rotation. Always, all the points that we talk about in YNSA technique, it's going to be sensitive.
Όλα πάντα είναι.
Yeah.
Πάντα θα είναι ευαίσθητα τα σημεία στη ψηλά σε όλα αυτά του YNSA.
Okay. The next point, it's called, we have a lot of lumbar issues in life, so it's also an extra lumbar and it can assist in lumbar pain.
Είναι έξτρα οσφαιρικό σημείο, άρα θα βάζουμε επιπλέον όταν υπάρχει πόνο στη διαλγεία.
And it's located on the mandibular bone, just in the midway between the mandibular angle to the mid-sagittal line on the chin. So all around here you will find on the bone a small notch.
Είναι πάνω στο οστό της γνάθου, της κάτω γνάθου, στο μέσο της απόστασης θα βρείτε εκεί στο μέσο της απόστασης μια μικρή εντομή.
Okay? Let's look at the point.
Ένα γενικό σημείο για οσφαιραγία.
That's the 4 point that we want.